I think one of the barriers to patient safety is that people are so busy that they think that actually doing their job and just getting through the task of working through the hours that they work is the main task. I think that taking a step back to that and actually focusing on patients as the most important partners in the care actually transforms the way that people think about the tasks that they do. And so I think you know, whilst one can understand the pressures that are on staff, and there genuinely are, I think that we urgently need to reframe the way that our colleagues think about the tasks they're performing through the eyes of patients, and that's one of the ways I think that we can improve the situation.
Thank you. So how important do you think it will be now that the NHS has a patient safety strategy going forward?
So I think the patient safety strategy is a very well constructed and written. I think the elements of it are very important and they're the right elements to focus on. And interestingly, over the last few years, the Care Quality Commission has produced a few reports based on our findings, many of which align completely with the content of the plan. So I think it's one that we support very strongly and as I say, mirrors many of the areas that we think are important areas of focus for the service.
Thank you. So how important do you think education and training is to support the strategy?
Absolutely critical. What we know from inspecting outstanding organisations is there are three key areas that shine out from those organisations. One is a focus on people, primarily the people that use the services, but also the people that provide those services. And the outstanding organisations really take that development and training of their staff extremely seriously. And actually the outcome of that is better care for patients. They also are compassionate organisations, and that compassion is obvious in terms of the interactions with patients, but also between the staff groups who provide that care for patients. And those organisations are curious. They're curious about how they can do things better tomorrow than they do today. And those three elements are underpinned by the leadership in those organisations who set that expectation, who set that culture and model the behaviours.
And so how important do you think a consistent patient safety syllabus is going to be in that world?
I think this is fantastically important work. One of the things that we do find is there are a number, and unfortunately a growing number of organisations that are already embedding this way of working, and they are outstanding as a result. But in terms of having a syllabus that we as the regulators and the organisations, perhaps more importantly, who are finding this difficult to work out the right things for them to do, I think having a syllabus like this will be useful to us all in trying to raise the level of the safe care that's provided for patients across the country, which of course is what we as the regulator would love to see.
And can I ask, what else do you think people need to know about patient safety in the NHS?
I think the first thing is that every individual, no matter who we are and what our role in our health service, we all have a personal individual responsibility. I think that overarching that is that the organisations for which we all work, they too, and particularly the leaders in those organisations, also have a responsibility. And I think their responsibility is slightly different. Their responsibility is to give us the time and the training opportunities to make sure that we're able to learn and spend time developing our skills in this area. And they also set the culture and the behaviours that are expected. And those really underpin the value of the safety training that people will receive.